Good afternoon. Today I have the great pleasure of introducing one of my extern research physicians who has come to work with us in New York. This is Dr. Mohamed, who was born in Sudan and went to medical school in Sudan and now works as a physician in Oman. And she came to New York to do some research with us on ME CFS. I now introduce you to Dr. Mohamed.
Thank you, Dr. Enlander. Thank you. Hi, my name is Mohamed. I'm from Sudan. I graduated from medical school there in a university called C.F.S University for Women. I'm currently practicing medicine in Oman for the past 4 years, and I came to New York to work with Dr. Enlander. He's one of the fewest consultants that dealing with chronic fatigue syndrome, and I'm interested in this disease and how it affects women's life.
Is it common in Sudan? Have you actually seen any patients?
Actually, it's not that common. Maybe it's not, or maybe the people are not familiar with it.
Not making a diagnosis, and physicians are not.
Yeah, probably they're not making a diagnosis. Yes, so this may be something new. That's why I'm interested, and mainly in women, because as a female doctor, I think I have a lot of commitment towards women specifically. Okay, according to the research, I found that 75% of ME CFS patients are women, and I will talk mainly about how hormone and immune system play a role in initiation of ME CFS. Okay, firstly, what is ME? ME can be defined as immunological dysfunction syndrome, but still we cannot neglect the role of the female sex hormone of being part of this pathogenesis. It can occur at any of the three fluctuation hormonal period of the women of women during puberty, pregnancy, and menopause. And I'm gonna talk about all these three periods. But first, I want to clear some points about ME, because most of the people think it's an autoimmune disease. Okay, well, I'll say it's, as I define it, is a immunological dysfunction syndrome that characterized by a massive fatigue or chronic fatigue that lasts more than 6 consecutive months and is not improved by rest. On the other hand,
it has, according to the Canadian classification criteria,
yes,
post-exertional malaise.
Yes, that's right. And on the other hand, autoimmune disease is an illness that occurs when the body tissue are attacked by your own immune system, and this is not happening in the case of ME. When it comes to the cause, we found that there is no specific cause for ME, but there are 5 viruses are found to be associated with ME, which are Epstein-Barr virus, cytomegalovirus, Coxsackie virus group B, HHV6, and parvo-B19. Although these viruses are important in ME, we still need to rule out other autoimmune diseases such as SLE, rheumatoid arthritis, multiple sclerosis, and Hashimoto's thyroiditis. Also, other diseases should be ruled out, such as Lyme disease, syphilis, cancer, and aplastic anemia. Both autoimmune and ME can cause massive fatigue, and both of them, they share several properties as the female gender. The woman is dominant in both of them. Also, the the improvement of symptoms with pregnancy in both disease, the involvement of the immune system, and the common pathogen triggers such as the Epstein-Barr virus. But still, there is no single study that attributes C.F.S. to autoantibody intrusion to your own body tissue. Okay, this will take me to why women more than men. Why is that? Okay, according to Gordon Broderick model, it suggests that females are more likely to develop ME because their sex hormone have impact both on the hypothalamic pituitary adrenal axis and the immune system. And it found out that a higher estrogen level in this study is related to the dysregulation of the HPA axis. This is the first hormone. The other hormone is the progesterone. It found that the higher progesterone level affect the T regulatory cells, which one of the type of the T cells that peak during the second and the third trimester and could be providing a link in ME CFS. On the other hand, I will talk about the male. The male, it's found that in this project model that male hormone protect them from having ME. It could be, in my opinion, I'm asking myself, is it because testosterone is an anti-inflammatory hormone, and for this reason is it protected, had this protective effect against ME? I can't say yes, but I will say we need researches on this, if it is the cause why it's protective. Okay, I'll move to how pregnancy, or how pregnancy improve ME. In other words, like why symptoms of ME is shown that there is improvement in their symptoms, the pregnant lady. Due to there is a research which done in 2004 found that ME, yes, truly it's the symptoms of pregnancy improved in about 1/3 of the patient, but still 1/3 of them the symptoms are getting worse and 1/3 remain unchanged. The symptom improvement we can attribute it to the fetal cytokines that traverses the maternal immune system. It could be. It's a hypothesis. Other thing, the hormones, which is I'm linking it all the time with the immune system. We know that the two hormones, mainly the estrogen and progesterone, are the main female hormone that are peaked during pregnancy. And the estrogen had this regulatory effect toward the immune system, as well as it is found that it increased the antibody level. On the other hand, progesterone found that it's an anti-inflammatory hormone, and also had this role in modulating the immune system. During pregnancy, we had another hormone, the third hormone, which is the human chorionic gonadotropin hormone. It is also called the pregnancy hormone. Okay, it is produced by the placenta, and it's found in a research done by Sunil Manna in 2000 that this hormone inhibits the activation on NF-kappa B, which is the inflammatory pathway that has been implicated as an important part of the ME CFS. I will give just a small explanation about the NF-kappa. It's a protein complex that controls the transcription of DNA, cytokine production, and cell survival. Okay. In addition to this HCG, gonna drop in pregnant lady. There's also increase about 1,000 times in a progesterone level in the versus non-pregnant. Given that viral reactivation, inflammation, immune system dysfunction, and neurotoxicity lie at the core of the ME symptomatology. Therefore, a 1,000-fold increase of progesterone as well as HCG would definitely alleviate ME CFS symptoms, but still more research is needed to be done in this. After the pregnancy part, we'll come to what? To the delivery part. Within weeks of delivery, we can notice that some of the mothers feel worse or they get relapse. And we can relate this to the sudden decline in the elevated hormone, the progesterone and the estrogen, because there is a drop in their hormones. It could be the reason why their symptoms getting worse. The other reasons could be the extra effort that the mother needs to take care of a new baby. I will talk now about the last part in the hormonal fluctuation in any woman. It's the menopause. People usually misconcept menopause symptoms with ME because both of them share the fatigue symptoms. So one of the medications that we are using in fatigue in menopause is the hormone replacement therapy, which is found to be very effective, but still long-term use of this hormone replacement therapy is associated with heart disease, cardiovascular risk, blood clot, and breast cancer. So is it useful to use hormone replacement therapy? We don't know that, but certainly it may help in a way or other. So we need more study and researches about this. And what is the hormone replacement therapy that I'm talking about? It's either estrogen or a combination of both progesterone and estrogen. There is other kind of hormonal therapy. I found the research about it. It's a bioidentical hormone replacement therapy, which is published by Janelle M. Love. It's found that these hormones are useful in patients with ME, and it's usually relieve them from their chronic fatigue by supplying their body with cortisol, testosterone, melatonin, and thyroid hormone. It's unlike the conventional hormone therapy. It's actually they are using hormone that is exactly identical to the hormone that produced by the glands. Well, there's a lot of study about this. So hormone can help to support the immune system.
Any specific hormones?
In combination, we can use the estrogen itself or the progesterone and estrogen in combination together, according to the situation of the woman. Okay. In regard to the abortion, because also I found that many young women I observe at Dr. Enlander clinic in their 30s and 40, and they are suffering from ME after having abortion. I was thinking, why is that? So, in my opinion, it's because of the elevation of the hormone due to pregnancy, and then after abortion, these loss of all hormone again, they will let the woman to get this fatigue and having all ME CFS symptoms. On the other hand, stress play part in this, because stress also can cause ME CFS. But in a study I found in a published study in regard to abortion with ME, which was done in 2004, it found that the greater number of spontaneous abortion in the pregnancy that occurs after ME can be explained by the maternal age and the priority differences. That means is still but not related to hormone, but as the study mentioned, like more investigation is needed on larger population. So we can say that in a like a brief summary about these hormones, is it because in pregnancy women had peak in their hormone and then it just dropped all of a sudden, and then they have this ME, and does the hormones really help to support their immune system? We don't know that, but I think we should give a trial for this. I will talk about two treatments in mainly are using in Dr. Enlander clinic as a part of his protocol for treating patients with ME, which is the MAF 878. And other treatment is not used by Dr. Enlander, but it's related to the woman. That's why I'm gonna talk about it. The first one, the MAF 878, maybe some of you heard about it, but before talking about it, I will just ask or talk about one simple thing, which is the colostrum. What is a colostrum? It's also related to women. Yeah, it's the first milk that is produced for the first 2 days after birth, and it contains a large amount of adaptive immune system such as lymphocytes and also many antibodies, but mainly the IgA antibody. What is its role? Why I'm saying this? Okay, before answering this question, I will ask as a question: what is the difference between the human colostrum and the bovine colostrum? Okay, human colostrum consists primarily of IgA, which is immunoglobulin A. On the other hand, bovine contain a high concentration of all immunoglobulin, which are IgA, IgM, IgD, IgE, and IgA. And why it's this huge concentration of antibodies is maybe because the cow is a very big animal related to human, right? Then I'll come to answer the question. I didn't forget. It's why I'm talking about this colostrum, because it's related to this MAF 878, which is the MAF 878 is a protein that includes bovine colostrum that activate macrophages via signaling and can help to overcome an induced immune deficiency. It's in a simple word, it's contain a probiotic bacteria and colostrum, which when added to yogurt or caviar, it produces MAF, which is macrophage activating factor, by activating the macrophages in the gut as well as improving the gut flora. And usually patients are using a half cup of a day, or we can say 2 to 5 ounces, and it may increase the dosage up to 8 to 10 fold. So that's why I talk about the colostrum. Then the other treatment is not used by Dr. Enlander, but I found it is related to the women mainly, which is the placenta. As I mentioned earlier, if you remember, there is a hormone called HCG, which is produced from the placenta. So, and it's very useful to support the immune system. In one study in Mexico, it's found there's a stem cell treatment, which is found to be amazingly helpful to the patient with ME CFS, because it affects the biological system in the body, the three major biological systems, which are the immune system, the hormone, and the circulations. And it's found out that patient with symptoms with or suffering from ME, they have improvement in their symptoms, mainly the concentration, memory improved, their energy level increased, there is improvement in their muscle pain. That means there is a reduce in the muscle pain, reducing the headache, and even their quality of sleep became perfect. The other thing which I found it very interesting is the placental bills. Have you ever heard about it? This is my first time I heard about this. It's a traditional Chinese medicine. It's used for postpartum healing. And how do you take placental bill? It's a practice of ingesting a placenta after it has been steamed, then dehydrated, ground, and then placed into a bills. And actually, in the study, or the people found it is very perfect and very useful, as it's have some benefit. One of its benefits is it balances the hormones, which is our main topic, the hormones and the women. Other thing, it's restore ions and energy level. Apart of that, from that, it has another benefits such as increasing the milk production, the corticotrophin releasing hormone, which, as mentioned earlier, it's the hypopituitary axis, the hypothalamus pituitary adrenal axis it related to. So it could be useful, these placental bills. We don't know, but we need to do more study about it. In a conclusion, I want to say that it's fascinating to know that hormones play an important part in order to support the immune system. And as a result of my study, I'm so happy that from now on, the hormonal levels will be tested, such as estrogen, progesterone, and testosterone at Dr. Enlander clinic, to see if there is any hormonal imbalance in this patient with ME. I guess maybe bringing down the hormones to normal level, either in men or women, maybe is not a cure for ME CFS, but I think it's a step toward making patient life more better and make them function better than before. According to my study, I hope this hormonal treatment will help, and further study will to be done on it, and it can open a path for other researchers or doctors to look up for this in order to help our patient to be cured or function more better because of their ME CFS. Thank you very much, Dr. Enlander.
Excellent, Sharif. I should actually emphasize that Sharif actually had not been exposed to ME CFS prior to coming to work with us, and she has actually developed a keen interest and will bring that keen interest back to wherever she actually practices. She actually is a very intelligent young lady, and I wish her all the very best, and we will help her in any way we can. Thank you, Sharif.
Thank you.